Hi, everyone, and welcome to this special episode of Office Hours. I'm Stuart Newsome, and today I'm here to share some reflections and insights from the recent AAPC HealthCon conference that was held in Orlando. So, as many of you know, AAPC, which is the American Academy of Professional Coders, has historically been associated with medical coding, but that narrative is quickly evolving. They now offer a broad suite of credentials that reflect the full spectrum of revenue cycle and compliance operations, including credentials such as CPB for billing, CRC for risk adjustment, CPMA for auditing, CIC for inpatient coding, and then there's CPCO for professional compliance officers like myself. So what stood out this year wasn't just the diversity in credentials, though, because I do appreciate that that AAPC has expanded their credentials. It's more than just coding, but it was also a wide variety and diversity of people from the professional standpoint. So I met people from across the full range of RCM, from intake and billing to denials, audit, compliance, and even legal, if you can believe that. But there was a lot of lawyers at this conference. So it was also a fantastic opportunity to reconnect with old friends, meet some new ones, and share ideas and engage in the kind of professional networking that makes conferences like this so valuable. So I always appreciate going to conference. If anyone out there who's never been to a conference in your professional setting, I highly encourage you to do so. There's a lot you can learn in sessions, but there's also even more you can learn by networking and sharing ideas and experiences with other attendees. So one theme that tied everything together, whether the session was about compliance enforcement, coding for E&M, risk adjustments coding, or OIG updates, and that was AI, artificial intelligence. It goes without saying. I think some of us may be sick and tired of hearing about AI, but it really isn't going away. It wasn't always the headline, but it always had this presence about it. The AI, you can kind of feel it in the air. It was definitely mentioned in just about every presentation. So there was this assumption, so to speak, in the air that AI isn't coming, it's definitely here. Uh, Basically, a foregone conclusion, if you will, that everyone is utilizing it like breathing in the air. So that assumption was very clear, and even with the presenters and even with some of the attendees, even though there were some who were like, wait a minute, we haven't really embraced this fully yet. And that's where I want to begin with today by walking you through five of the sessions that really stuck with me and offering some takeaways you can reflect on in your own work. So the first session I attended was titled, What is Your Potential Legal Liability If Your Practice is Investigated? And this was presented by an attorney, Robert Saltaformaggio, Esquire. He's a senior counsel at Lyles Parker PLLC. So this was one of the most sobering takeaways from the conference. It focused on what your personal exposure could look like if your organization is ever audited or investigated. So it was very eye-opening. So this wasn't a scare tactic session, but it was really a wake-up call. So whether you're a part of a small practice, a billing company, or a larger system, the message was clear. Personal liability in healthcare is very real and it's growing. So there's been a noticeable shift in how the Department of Justice views enforcement. So it's no longer just about penalizing the organization, it's about holding individuals accountable. So owners, billers, coders, consultants, anyone involved in the decision change or anyone that could possibly touch a claim could be on the hook. And this is especially important for those of us in compliance or other leadership roles. So what really struck me here was how many cases involved smaller practices. And what I mean by smaller practices, I mean those that are fewer than 50 employees. And how often the absence of formal compliance program played into those outcomes. And in fact, the vast majority of the prosecuted companies didn't have one at all. No compliance program, no compliance parameters, no guidance whatsoever. So the presentation broke down several key enforcement areas: the False Claims Act, the Anti-Kickback Statute, and the increasing use of whistleblower complaints. And not to get too far into the weeds here, but the numbers were staggering. There were more than 979 whistleblower cases filed last year alone, and that's the highest it's ever been. One of the biggest misconceptions is that you have to intentionally commit fraud to be found liable. But terms like reckless disregard or deliberate ignorance, if there is such a thing, uh, they really came up a lot. So if you're turning a blind eye to questionable documentation, maybe non-compliant billing, or maybe some risky business relationships, that can be enough to trigger some action. So there was also a lot of discussion about safe harbors. Under the kickback statute, the takeaway was, well, they were very complicated. So contract or arrangement qualifies unless you've done a thorough review, preferable with some legal counsel. So with all the complication involved, there was still some good guidance that this particular attorney actually offered. So another interesting point was how the lines between civil and criminal enforcement are blurring. So practices that would have once only led to fines are now resulting in criminal charges, especially when prosecutors believe there's deception. Again, going back to that deliberate ignorance or reckless disregard, even if it's just exaggerated statements or even some documentation gaps. So they're expanding their wings, so to speak, or the span of the scope of those prosecutions. So what do you do with all this? Well, the answer is pretty consistent with what most of us in compliance already know. Document everything, audit proactively, and educate your team. I can't just stress that enough. It's documentation, it's proactive audits regularly, and educating your teams often. And most importantly, don't assume that because you're not the provider or the owner that you're shielded. If you're in a position of oversight, you could be seen as complacent. So the second session that I saw, just shifting gears a little bit, because if there was one theme that echoed throughout the conference, it was change. Change in compliance, change in how we're regulated, and especially change in tools that we use. So one of the most memorable sessions for me was called Navigating the Crossroads of Change in Medical Coding. And this was presented by Lisa L. Campbell. She's a PhD, so she's Dr. Campbell. But this session focused on how medical coders are navigating change, especially with the rise of AI. So there's no denying it. AI is here. It's not coming, it's not looming, it's already woven into our revenue cycle, our coding platforms, and our documentation workflows. So what I really appreciated about this session was how it didn't just highlight the technical stuff, but really explore the human side of the change. What are the mindsets? What are the fears? What are some of the emotional resistance that often comes from new technology? So Lisa talked about this concept off of a fixed mindset versus a growth mindset. And I think that resonated with a lot of people in the room. A fixed mindset says AI is taking over, I can't keep up. But a growth mindset says this is a tool. I can learn it, I can evolve, and that really set the tone for what is meant to be resilient in a field that's evolving very, very fast. There was also a great visual about how AI assisted coding actually works, from NLP reading, the documentation, to code suggestions, to compliance flags, and then the human coder reviewing and finalizing. That's part, that part is very, very critical. We're not being replaced, we're being repositioned. And you've heard us say that over and over again here at Infinix, and I've also heard it in other presentations and in other formats, that it's really more of an augmentation. But our value is definitely shifting toward oversight, compliance, auditing, as well as accuracy. I also appreciated how the session tackled self-sabotage, because let's be honest, a lot of resistance to change is fear in disguise. The fear of not knowing where you fit anymore, the fear of not having the skills. But the message was clear. You take small steps, you get peer support, and ongoing learning are how you really overcome this. So what does that mean for coders and really anyone in the revenue cycle space? It means learning to be AI literate. It means getting comfortable with platforms that assist, not replace. And it means shifting from data entry to value-added roles like validating AI outputs, ensuring compliance, and managing exceptions. That's where the future is headed. Now, another big takeaway from the conference came from a session called the OIG Compliance Symposium, Ensuring Integrity and Accountability in Healthcare. And this was presented by Yvonne Antonio. Now, this session focused on building integrity and accountability within our organizations, something that's becoming more than just a checkbox exercise. It framed compliance as a strategic advantage, not just a legal necessity, And I think that message landed well with a lot of attendees. Now, we're seeing a significant shift in how compliance is viewed, especially by executive leadership. It's no longer siloed within a department. It's becoming part of a corporate strategy, risk management, and even performance evaluations. So the message was, if you're not prioritizing compliance, you're exposing your organization to financial, reputational, and legal risk, and that risk isn't going away. Now, this session went deep on what the OIG expects in a modern compliance program, and I do mean modern. Some compliance programs just haven't been updated, if you had one at all, in several years, if not over a decade. Now, it's way beyond having a manual or some annual training. We're talking about AI-driven risk assessments, real-time auditing, governance structures tied to executive oversight, and proactive culture building. It was encouraging to see how much emphasis was placed on using data and technology to strengthen internal controls. There was also some compelling case studies, everything from telehealth fraud and EHR vendor kickbacks to upcoding trends and excessive utilization. But what stood out wasn't just the penalties, but how many of those cases would have been prevented with stronger internal checks and training. And speaking of AI, yes, even in compliance, AI is being used more and more. There's predictive analytics and anomaly detection as now part of the enforcement playbook. That means providers and revenue cycle teams need to match that sophistication if they want to stay ahead of audits as well as investigations. Now, the big takeaway here was that compliance, when done right, supports revenue integrity. It builds trust with patients, partners, and regulators. And the organizations that embed compliance into their operations, not just as a defensive move, but as a forward-looking strategy, are the ones who will come out stronger. Now, let me zoom in on one of the most focused and frankly eye-opening sessions I attended, which dealt with HRAs, or health risk assessments, and the risk associated with inaccurate HCC coding. Now, this session was titled Bad, Better, Best Practices, Avoiding FCA Liability for False or Invalid HCC Diagnosis from HRAs. And this was led by a trio, a team, if you will, that have done many presentations together in the past, and I've had to listen in on, and they're very dynamic. But it's Edward Baker, who actually represents whistleblowers. He's an attorney. It was Colleen Giattasaio, who is also on the payer side. And then there's Dr. Kush Singh, who's actually a physician, but is also heavily involved in risk adjustments. Now, if you've been paying attention to recent enforcement trends, you know this space is getting a lot of scrutiny. This session drove home why they're getting all this scrutiny. So the short version, well, HRAs can be a double-edged sword. Done well, they improve care coordination and documentation. Done poorly or manipulatively, they become a liability minefield. And that's where False Claims Act risk really starts to escalate. We walked through a well-known case study involving Cigna, where the DOJ and a whistleblower combined forces to allege that unsupported HCCs were being captured in HRAs simply to boost risk scores. And the result, well, it was a $172 million settlement and a 5-year corporate integrity agreement. And as the presenters put it, that case sent a very loud message across the industry. But this wasn't just about naming and shaming. This session was built around practical, real-world advice using that bad, better, best framework that was in their title. It was one of the most approachable ways I've seen legal risk broken down for coding, compliance, and clinical folks. For example, one of the key questions asked was, what's the intent behind your HRA strategy? A bad practice would be using HRAs strictly to hit HCC capture quotas, with pressure on clinicians to just check boxes. Better would be using HRAs to reach patients who don't make it to the clinic. And what the best practice was is making sure that HRA outcomes actually flow back to the care team to guide treatment and validate the coding, which is what it's intended to do. It also addressed who's performing the HRAs, how much training they have, what tools they're given, and how much time they get with the patient. Over and over, the emphasis was on documentation integrity, follow-up, and data use, not just data capture. I walked away from this session with a clear sense that risk adjustment is one of the next major battlegrounds in compliance. And the takeaway wasn't to stop doing HRAs, it was to do them well, do them transparently, and most of all, make sure they improve patient care, not just the bottom line. Now, one of the most talked about sessions at HealthCon was the deep dive into the OIG's new General Compliance Program guidance, or the GCPG. Like, we just need another acronym in this industry, right? But that was released in late of 2023. And let me tell you, it's a game changer. Even if you haven't cracked open the 91-page document yet, this session led by Dr. CJ Wolf, also a physician, and he entitled his session Advanced Exploration of OIG's New Compliance Guidance, um, gave a very digestible overview of what's changed and why it matters. So what's different now is that the guidance is meant to be more accessible, more actionable, and most importantly, more relevant across the board. So whether you're a hospital, a coding shop, a health plan, or a tech vendor entering the healthcare, these updates are for you. The OIG has also started rolling out sector-specific guidance like ICPG for nursing facilities, with more to come in areas like Medicare Advantage and labs. So there was also a new tone from the OIG, less of a policing posture and more of a partnership mindset. The updated guidance encourages organizations to be proactive, data-driven, and integrated in how they approach compliance. For instance, one big shift was the emphasis on tying compliance directly to quality and patient safety oversights. So that's a huge signal that the government is no longer treating compliance as a back office operation. It's frontline and it's strategic. The guidance has also placed new weight on issues like HIPAA, cybersecurity, information blocking, medical necessity audits, and even how leadership culture and executive incentives align with compliance. So this is about embedding compliance into the DNA of your organization, not as a necessary evil, but as a trust building, risk mitigating business function. Now, another point that stood out is the compliance officer's stature in the organization, and this is very important. The guidance recommends direct access to the board or the CEO. Reinforcing compliance shouldn't be buried, it should be empowered. So, in other words, compliance shouldn't be under the legal team or have to report to, say, the attorney, for the practice or the organization. It's actually a separate division, autonomous, that only reports to the CEO of the board. Now, all in all, this session really reminded me how fast the bar is moving and how we need to treat compliance as both a differentiator and a responsibility. It's not about just staying out of trouble anymore. It's about creating systems that prevent it from happening in the first place. And that requires commitment from every level of the organization. Now, as you can probably tell, my focus at the conference was heavy on compliance because that's where my CPCO background leads me. But there were many other sessions, nearly 90 total, ranging from topics on coding, billing, outpatient, inpatient, career enhancements, and much, much more. As you've heard across these 5 sessions I've summarized, this year's AAPC HealthCon carried a clear through line. Change is accelerating, compliance is maturing, and AI is no longer knocking at the door, it's in the room. So whether we're talking about individual legal liability, best practices for HCC capture, or the OIG's update, compliance expectations, there was a noticeable shift toward accountability, personal accountability. That means clear policies, more training, and better documentation. But it also means preparing yourself and our teams for a different kind of work that's more strategic, more analytical, and often more dependent on technology to help us do our jobs very well. So to undertone, the undertone of the artificial intelligence was present in just about every conversation I had, whether it was on stage, off stage, over coffee, or at a networking event. But what stood out to me was the shift in how people are talking about it. Gone is the apprehension of the unknown. It's now more of a collective exhale, if you will. So, a quiet acknowledgement that AI is a foregone conclusion, not a fearful way, but in a way that says, okay, it's here, so now what? And that what is where it gets exciting. AI isn't just reducing keystrokes or suggesting codes, it's creating new roles. It's changing how we define expertise. It's pushing coders into auditors and compliance oversight roles. It's turning data reviewers into strategic advisors. It's demanding that compliance officers evolve into risk mitigation leaders with visibility across departments. If I had to sum up the vibe of HealthCon 2025, I'd say it was cautiously optimistic, with an emphasis on preparedness, collaboration, as well as professional growth. So there was a lot of warmth and a lot of candid honesty and a shared sense that people who succeed going forward are the ones who are willing to evolve with curiosity, not fear. And while today's session was just me sharing my personal reflections, I wasn't alone in these observations. So next week, we'll have an upcoming episode of our RCM Insights, which is part of our Revenue Cycle Optimized podcast series. And if you haven't subscribed to that, I really would encourage you to go out there. We release about 4 episodes a week, one including repurposing our office hours episodes. But in this particular episode that's going to be released next week as well, I'll be sharing interviews I recorded on site with other attendees. You'll hear from professionals across the revenue and compliance cycle, such as coders, billers, auditors, risk officers, sharing their take on AI, shifting expectations in their roles, and where they think the industry is going to be headed. It's going to be a valuable companion to what we've talked about here today, so I hope you'll tune in. So thanks again for spending this time with me. Stay sharp, stay compliant, and I'll see you next time on Office Hours.